Hi, everyone. My name is Johnna Devereaux. I'm the Chief Nutrition Officer at Bow Wow Labs. And today I have a very special guest, Amy Deandra from Pet Emergency Education is here with us. Amy has like paragraphs of her bio. So I'm going to try to summarize this. She's been a veterinary technician for over 28 years, holds registrations and certificates in various states. She has been part of the National Association of Veterinary Technicians in America for decades, right? And you were the
A
president, I
long
want to
time.
say, in 2006. You don't look like you're
Mhm.
old enough to be there for decades, but you know. And Amy has, well, I have a firsthand experience with Amy. So about 8 years ago, I took a CPR class for dogs with
Yeah.
Amy through Pet Emergency Education, and it was one of the best things that I ever did. It gave me a skill set that I unfortunately had to use on my own dog at one point, which we'll probably talk about. But Amy, what did I miss? I know there's a lot of other stuff to talk about.
Oh
About
yeah, no, I'm really excited to be here, and I'm always, that's my job, is to educate people to hopefully help their pets, so that if their pet ever comes in contact with some type or experiences some type of medical emergency, they'll be better prepared to handle an emergency, and be able to know what to do, and how to take care of their pet, so that you can keep them alive, or can keep their condition from getting worse until they get to a vet clinic. It's been my passion for a very long time. I've been in education, not only veterinary medicine, but education for many years, even graduating from vet tech school way back in the early 90s. So I've been there, done that. And again, I'm pleased to be able to share this information with people who find it valuable.
Yeah, thank you. And obviously, our whole company, Bow Wow Labs, was founded on the idea to prevent dogs from choking on the last inch of a bully stick with our Bow Wow buddy. So this topic is near and dear. So let's just jump right into it. So how
Yeah.
common, let's talk about choking first, because that is something I think that um, a lot of pet parents, for whatever reason, either with bully sticks or other long-term chews or anything, because correct me if I'm wrong, but anything that is large enough to potentially obstruct the airway is considered a choking hazard. So even some of the
Absolutely.
most common dog biscuits that we would never think about it, if your dog chews to swallow that versus chew it, that is the potential for a choking hazard, right?
Of course. And I think that some people they don't realize things that dogs could, choke on, things that are in their home, around their yard, around their environment, that, think that, oh, they would never chew on that, or I don't think that that would be a hazard. And they do. And we see it all the time in vet clinics, where dogs come in choking on some observed object that the owner just never realized would be potentially a problem. And it can be everything, not just foods and toys, but it could be, objects and furniture, pieces of furniture, plants, sticks, rocks are a big one too. We had a dog that, that came into the clinic that had a fetish for chewing on clothing and cloth, and had come in a number of times choking on, a sock or something that would get lodged in their throat. So you kind of have to think outside the box when you have, a pet in your life, and especially a young one that's very, intrigued and curious about their environment and things that are in their environment, and kind of, just be prepared to prevent emergencies from happening, because a lot of emergencies that I saw come into our clinic could have been easily prevented. I've seen choking, poisoning, hit by car, dog fights, things that if someone had just taken the extra step to be a little bit more cautious and prevent that situation from happening, their animal wouldn't have been in that situation.
I'm a big advocate for being proactive in all things. So I agree. So let's talk about choking. How common is dog choking? I mean, I know that we've always gone off of the statistic that over 200,000 dogs go per year for choking hazard, but I bet that it's even higher than that.
Hmm. Well, it's hard to quantify a statistic on it, because my experience might be different than another experience in other clinics. But I know for a fact, as a vet tech that's worked in this industry for a long time and knows a lot of veterinary professionals and teaches classes to a lot of veterinary clinics, it's almost a daily occurrence where we're seeing, animals choking on something. If you work at an emergency clinic, I know if I asked an emergency tech, how often they see choking, I'm sure they would tell us quite frequently. And a lot of times it's a preventable hazard where the animal's choking on something that they got into or was able to reach, that they shouldn't have. And I think that, again, one of the biggest ways to treat choking is to prevent it in the first place. And a lot of what we teach in our classes is the very first section of our classes is how to prevent emergencies from happening in the first place,
Right.
because they can so often be prevented, and choking is definitely included in that factor.
So what are some of the signs to know that your dog is choking or having a hard time getting something down?
Sure. So some symptoms for choking would be kind of like acting like the animal is trying to vomit, but nothing is coming out of their mouth. They might be having trouble breathing. You hear like gasping sounds as they're trying to get air into their airway. Some dogs will paw at their mouth like something is stuck, so they're trying to get it out, but unfortunately, because it's so far back in the airway, they're unable to get it out themselves. Excessive coughing. Let's see, and in serious situations, they can collapse. If the animal is gone without oxygen for a few minutes, it can actually lead to them going unconscious. It only takes 5 minutes of lack of oxygen to the brain for an animal to start to sustain brain damage. And with 10 minutes without oxygen to the brain, it gets to the point where the brain then sustains serious and life-threatening brain damage where potentially the animal's not going to survive. So we don't have a lot of time that if an animal is choking and not able to get air into their lungs to save them before something, they go unconscious or go into cardiac arrest and unfortunately, maybe choke to death. So
Yeah.
clawing at the mouth, coughing, retching, maybe like hunched over, acting like they're trying to vomit. Those are some key signs that there might be something that the animal's choking on.
And, for full disclosure, I think it's really important that all of our viewers understand this can happen to anyone. I am a clinical pet nutritionist, and this happened to me. I had given my dog, this was several years ago, a pig ear just to chew on. And of course, like all times when I'm giving my dog something that takes more than 2 seconds to bite, I am in the vicinity and keeping an eye on her. And thank God I did, because she got down to a very small piece of the pig ear. And the way that she ate it, it went flat and blocked off her airway. And she was sitting there, and the look you never want to see on your dog's face is the one that I saw on mine. She wasn't able to breathe. She was pawing at the mouth. Luckily, I had taken your class, so I knew how to do a finger sweep and get it out. It was big enough that I could do the finger sweep. But not everyone is going to necessarily be that lucky where they've taken the class. So how would you tell people if they've identified that there might be something wrong? What is the first thing that they do to assess the situation? And then what steps do they take throughout to clear the blockage?
So good question. So really how step-by-step process to manage an animal that is choking is if you see the symptoms that I just mentioned that you suspect that they're choking, you want to very carefully, and again, I have to give the disclaimer carefully so that, if anyone gets bit, they understand that that is a, kind of a risk factor that could happen. But very carefully, you're going to open the dog's mouth and see if you see the object in the oral cavity, somewhere in the back of the mouth, because a lot of times these objects can get lodged in the mouth, in the back of the mouth, and cover the airway, but they're actually not all the way down in the airway, and you could still potentially reach them. So one way, there's a couple different ways to sweep an object out. And again, I have to give the disclaimer that you need to be very carefully, because the first way is to actually put your hand in their mouth. You take your finger and you do a side finger sweep. Actually, my little buddy Josh here, bring him over. And so if you see that the animal is choking and you want to try and do the finger sweep, you're going to take them very carefully. You're going to take your thumb and your index finger and whatever your non-dominant hand is. I'm right-handed, so I'm going to use my left hand. And you're going to grab them right in their jaw behind their canine teeth. And those are the long teeth on either side. You're not putting your hand in their mouth. You're just putting it around their mouth so that you can hold it open. Then you can take your finger and you're going to very gently try to pull down their jaw to see if you can see anything down in their oral cavity. We call it oral cavity. That's basically in the mouth. And you want to do your finger sweep from side to side. So what I mean is you're going to go, I don't know if your viewers can see this, but you're going to go into the side here inside their mouth, and you're going to try to hook behind that object and pull it forward. Now, you never want to go straight in like this to try and grab it, because what happens is when you're doing this, you might accidentally push it further in. That
Right.
happens all the time. So you always want to go to the side, try to get behind it. That's why we call it a sweep, like you're sweeping it out, and try to pull it forward. Another helpful tip, and especially if you have, dogs that are clenching down on their jaw and you're afraid they're going to bite you, is you can use something like a tongue depressor, or the, end of a wooden
Popsicle stick,
spoon.
if something you might
Yeah,
have in your house.
popsicle stick. Yeah, we even have popsicle sticks, like a large popsicle stick tongue depressor in our first aid kits. You can use that instead of your finger. Put that in, get behind it, and that way you can kind of flick it out that way, and you're not putting your hands in the mouth. And the last suggestion I have, and this one that can be used, is a pair of salad tongs. So I have a small they're like about this long, got them at the dollar store, just plastic salad tongs. And salad tongs, you can actually go into the mouth and you can grab objects and pull them out. So the salad tongs are going down the sides of the mouth. We're not going down the center, we're going down the side. Yeah. And we're able to grab that object and pull it out that way. Salad tongs work really great for balls, especially because there was an article in DVM 360, which is a very popular veterinary magazine that veterinary hospitals get. And it listed that throughout the country, they surveyed veterinary clinics, and they found out that the number one thing that dogs choke on are balls. And I think it's because people play with their dog with balls as toys that are too small for the breed of dog or size dog you have. So if you're playing with a Labrador Retriever and you have like a little, rubber racket ball, that's more likely to get stuck in the mouth. And if you have something like that, it's hard to get your finger around a ball, but salad tongs work pretty good for that.
Yeah, that's a really great idea. And, it just reinforces what I always tell everyone is no matter what age your animal is, desensitize them to your hands, right?
Mhm.
The best thing you can do is have your dog let you touch them anywhere in any way, shape, or form, because God forbid you're in this type of situation and you need to not be worrying about if your dog is going to bite you, right? You need to be worrying about getting what's blocking the airway, because to the stat that you said before, at 5 minutes of no air, you're already starting to see brain damage. So, I think that's something really important for everyone to keep track of. So
Mhm.
balls are interesting that you mentioned that, because I saw an article probably going back a few years ago with the idea that a lot of the racquetballs, people are using the racquetballs and they toss them to the dog. And as the dog is sitting there trying to catch them, that's really when they're becoming lodged. And we're not talking about giving a racquetball to a chihuahua, right? We're
Yeah,
talking about giving a racquetball
to a larger
to
dog.
a larger dog. And I don't think people necessarily think about that, because we are being so innocent when we're trying to do good things with our dogs. So your
Yep.
message about being proactive is going to be really important. So let's talk post. I know this is not something necessarily that you talk about in your classes, but as a vet tech, you've seen this on the other side. If there has been some type of choking, if you've been able to get it out, there's potential that there's been some type of trauma, right? So what do you do after you've now removed this from your dog's body, and I guess, or mouth, oral cavity, and if it's been more than 5 minutes, just what are the next steps?
Okay, so once the object is dislodged, and one thing I didn't mention in the steps of dislodging an object is, if you are unable to get that object out through the means I just described in those 3 ways, you might have to do the Heimlich maneuver, and the Heimlich maneuver is very different on pets than it is on humans. So humans, we stand upright and someone stands behind us and pulls into our chest, but for dogs and cats, their heads have to be facing down so that gravity can help pull the object out. And for small dogs, we actually put them on our, and cats, we put them on our arm that we can lift, and we're going to face them downwards, and we're going to do 4 back blows. So 1, 2, 3, 4. Very similar to if you have done Heimlich maneuver, or if anyone's learned about the Heimlich maneuver of babies, babysitter course, or if you're a nurse or a first responder. So that's one way. And then for large dogs, we actually wrap our arms around their belly, and we bend over with their head facing down, and we pull up into our chest. So we're facing down, the dog's facing down. So the Heimlich maneuver can also force an object out of an animal's airway if you're unable to sweep it out. And then once that happens, you really need to pay attention to see if the animal is breathing or not. because it's covered the airway, there might be a likelihood that the animal is now suffocated and not able to breathe, and their respiratory system stops working, their lungs stop functioning. And in some severe cases, they can actually go into cardiac arrest, and then we'll need full CPR to revive them. So things that you want to look for, you can see their chest. If their chest rises and falls, that's when they're expanding and contracting. That's when they're taking a breath. See if you can see that. You can also put your hand on their abdomen to feel the chest moving in and out. When you place it on the abdomen, you can actually feel the diaphragm, which is a muscle that divides the chest from the belly, and you can feel that moving in and out. You can listen to see if you hear air coming out their nose and like a whooshing sound by your ear. So these are all ways to determine if the animal is breathing or not. Now, if the animal is not breathing, you can do a couple rescue breaths. We teach how to do rescue breathing in our classes. Rescue breathing is also a part of CPR. So we will, when we do rescue breathing, we pull the tongue out, we close their mouth, and we're going to wrap our lips around both nostrils, and you're going to blow. And what that does is it inflates the lungs. It's kind of like a lawnmower or a chainsaw. When you're pulling that ripcord, you're really just trying to jumpstart it into action. When we're doing rescue breathing, that's what we're trying to do. We're expanding the lungs to remind the lungs how to function. Oh, you know what? Now I have to bring air in, and it starts it up working again. So you do like 2 rescue breaths every 5 or 6 seconds to try and get the animal to start breathing on their own. And then unfortunately, if their heart has stopped as well, you'll have to implement full CPR, which we do teach in our classes. It's one of the foundations of our classes. So we welcome anyone, if you're interested in learning how to do, the Heimlich maneuver and CPR, to come and check that out.
Yeah. And one of the things I remember is if your dog is breathing, if you can hear a breath, do not try to put air in their lungs.
Correct.
You want to leave them alone. Like I remember that being a very big point in your class.
Yeah, because you could cause them to stop breathing. So just like if the animal's in cardiac arrest, you don't want to do compressions and start trying to pump their heart if their heart is actually functioning, because you could cause it to the animal to stop, the heart to stop beating. So that's very true.
So if the trauma has happened in the throat, what I would say is obviously go see, make an appointment with your vet right away, obviously, depending on the severity of the emergency. If you've been able to dislodge and clear the airway, if you've been able to get something out of the airway via the Heimlich maneuver, contact your vet. There might be some damage to the trachea at that point. And so you'd want to obviously, feed a different type of diet. Potentially there might need to be some medication. So that would be something that you'd want to follow through with your vet about obviously. So I know this is just one aspect of what you do at Pet Emergency Education, but what are some of the other things that people can learn? Let's just say if they wanted to go take a class, what else can they learn besides how to do CPR, which by the way is really important. I'm so glad that I have that in my book of skills, thanks to you. And obviously the finger sweep, which I had to use. Thank God it was never to a point where it was further than that. But you teach first aid as well. And what else is included in some of your courses?
Yep. So what we do is we teach people how to recognize emergencies, how to identify what the type of emergency is. So we talk about triage. We teach people how to transport injured animals so that they don't make the injuries worse and they can get to a vet clinic and have the best opportunity for, being fixed, so to speak, and surviving. We go through all the different parts and pieces of equipment that we recommend from a pet first aid kit. We of course carry our pet first aid kits that we've custom designed ourselves with what we feel is the most important equipment and supplies that you should have to manage all these emergencies. And we teach everyone how to use all the equipment and supplies in a pet first aid kit. And then of course we talk about a dozen or so common medical emergencies that can affect dogs and cats in the home, when they're at the dog park, when you're hiking, camping, biking, boating. We really try to make sure we cover all the bases. So if people, no matter what they're doing with their pet and what situation the pet could, come in contact with, they'll be prepared to be able to treat it. So we do allergic reactions. We talk about burns, shock, seizures, a lot of wound management, how to recognize wounds, how to treat wounds, how to bandage. Then of course the Heimlich maneuver, we go very involved in the Heimlich maneuver. People are, we work hands-on with doing the Heimlich maneuver, and CPR is also a very large part of our class because we do certify people in CPR and first aid and pets. There are a lot of companies that don't. They just give you a certificate of completion, but they don't actually certify you. So we get what we feel is a very diverse educational experience and a very detailed educational experience so that people are prepared to manage not only these medical emergencies, but provide CPR to an animal that's in cardiac arrest.
And it's especially important for people that don't have an emergency veterinary office within, a certain distance of their home to be taking your classes, because that could really mean the difference between your dog or your cat surviving if you're able to manage the scenario, even if you can't fix it or eradicate the body from whatever's going on, if you can just
Right.
maintain it until you get somewhere. So I would implore everyone to go check out your company and take those classes. Is there anything else you want to talk about?
I mean, I just want to make sure people are aware and understand that animals are tricky little critters, and they can get into trouble that you may not realize. And like we talked at the beginning of the discussion today, there are a lot of emergencies that can be easily prevented. So being knowledgeable about, things that are toxic to pets, not just foods, but plants and chemicals and other hazards in the home. If you're adopting a new pet, or bringing home a new puppy or kitten, or even an older animal, you want to really inspect your home, make sure your home is safe. Prevention is just really key. There's just so much I have seen in my career that animals that unfortunately died, or their conditions were pretty bad, and we were not able to make them any better because they were affected by an emergency that could have been prevented. So prevention is important.
And it sounds silly, but the easiest way is to change your perspective, right? Get down on all fours, and this is as silly as it is, and go around your house on all fours. And you will see things from your dog's perspective. Cats a little bit different because they're going to jump up. And, dogs definitely investigate everything with their nose first, and their mouth is right there. So they are very much inclined. I kind of, sometimes it's like a shark, right? Where they bite first to see if they like it. Like dogs are going to sniff it and then maybe put their lips, their fleas and their teeth on it before they do anything. So just get down on their level and kind of go around and scout out the house. How can people learn more about your courses?
So you can go to our website, petemergencyeducation.com. And on our website, you can look at all the different courses that we offer. We offer 6 certification programs now, not only for dogs and cats, but we also have emergency first aid for horses, reptiles, birds, small mammals. We have a wilderness emergency first aid certification course for dogs. So that's for people who take their dogs out doing recreational activities such as hiking, biking, camping, boating, hunting. And we talk about the emergencies that could, potentially, injure a dog in those types of scenarios. And we're about to launch our new livestock first aid class in about a week or two. And that's going to talk about emergency first aid for cattle and pigs and sheep and goats. So we like to think that we are not just a pet CPR company. We have evolved into being so much more than that. We're now really covering all domestic species that people have in their lives that they love and keep as pets. And we want everyone to keep their pets safe, not just dog and cat owners, but everyone who has a pet. We want to make sure that we educate them how to take care of all those pets. And we love to hear success stories from people that take our classes, and maybe their animal sadly something happened to them, but they were able to save them, or were able to make their condition better because of something they learned in our class. So definitely go to our website. We have our course descriptions. We have a list of all of our classes that are being offered on our website. And if we don't have a class in your area, you're welcome to take our class online. We have Zoom training, usually about once a month. And we have our on-demand self-paced training courses where you can get certified as well. So we have a course for everyone. So if anyone wants to learn this information or is interested in being trained and certified, we can definitely make that happen for you.
That's fantastic. Thank you so much for all this great information. Like I mentioned, if I didn't take your class, I would have been in a much different situation with my dog. So I can personally attest that this is a course you guys should all look into. So thank you so much for your time today, Amy. We appreciate it, and we hope you have a happy holiday.
Great. Thank you so much. I appreciate it too. And yeah, everyone have a great and safe holiday.